Can I just first acknowledge the Minister's work in regard to her early days in the COVID committee? I think she was one of a number of ministers who were promoted, obviously, and I suppose that opportunity was given to me then to take up the mantle. So it gave me my first opportunity as a new TD to kind of experience the work of a committee. So I suppose I'm grateful the fact that I was one of the first substitutes in. But look, on to serious business. Yesterday, the death toll from the virus surpassed 2,000 lives, a sad and sobering milestone for this country. Despite the positive signs regarding a vaccine, it is obviously too early to be excited. As indicated by previous speakers, there is much ground yet to cover and many more decisions that require careful deliberation. As of 8 a.m. this morning, 285 COVID patients are hospitalised, of which 33 are in ICU, with an additional 29 hospitalisations in the last 24 hours. The number of virus outbreaks nearly doubled compared to the previous week, figures from the HPSC show. There were 1,027 clusters this week, up from 572 the week before. The number of outbreaks in private houses more than doubled, up to 954 from 443 the previous week. There were 20 workplace outbreaks, and the number of school-based outbreaks did decline from 24 to 10. Among the workplace outbreaks, 89 were in food and beverage facilities, while 55 were in meat or processing plants, or fish processing plants. I quote these statistics not to scaremonger or delegitimise the massive efforts by all stakeholders, but to convey that this virus is still prevalent, still as deadly as ever, and still requires people to be cautious in their activities and to take all necessary precautions when they do have to go to work, or travel, or go to school, or whatever the case may be. This report examines the state's response to COVID-19 as it evolved since early 2020. The report undoubtedly highlights specific areas that require ongoing oversight and accountability that will now be scrutinised under the different sectoral committees of the Oireachtas. I myself sit on the Education Committee, and already we have had regular interactions with key stakeholders in that sector regarding how we deal with the virus in schools and ensure our schools are indeed as safe as can be for our students. As recently as this morning, we had various representatives of school staff conveying concerns that they have with ventilation in schools, social distancing measures, and staff-students' health concerns. A key finding of the report was that the state became overly focused on preparing acute hospitals for the oncoming pandemic in February and March, and failed to recognise the serious level of risk posed to our most vulnerable in our nursing homes. I think the report succinctly details how there were delays in reacting to a deteriorating situation in nursing homes, especially in the provision of PPE and the replacement of staff. Indeed, some of these concerns reoccur even to this day. While massive efforts were made by nursing home staff, there are unanswered questions as to why nursing homes were free of COVID, while others were severely impacted throughout the death and sickness of residents and staff. The first recommendation of this report, to investigate and report on all circumstances relating to each individual death from COVID-19 through a public inquiry, needs to happen as quickly as possible. There has to be accountability for the relatives of those who have lost loved ones in these circumstances. Failure to provide answer to these relatives would only exacerbate the pain and suffering already experienced by these families. The main theme running through this report relates to preparedness. This is necessary as we learn to live with COVID-19, which will be with us for some time, until we find and supply an effective vaccine. The state will experience periodic peaks and troughs in terms of incidence of the virus, and it is necessary that our public health authorities are given every tool available to react to these fluctuations. The committee is unanimous that if we are to avoid further lockdowns, a highly efficient and effective testing and tracing system is a prerequisite. We need to strive to do more. Turnaround times need to be constantly improved. New forms of testing need to be considered. Everything needs to be kept under constant review. The state needs to aspire to facilitate ongoing, uninterrupted serial testing in all congregated settings. I do believe that this report highlights the vulnerability of some of our low-paid workers and the need to provide for adequate sick pay entitlements for all. I welcome Government and Opposition's unanimity in pursuing this goal. It is agreed that many workers would have attended work in congregated settings in meat factories, direct provision centres and so on, because of the fear that the absence from work could potentially lead to a loss of income. We need to ensure that adequate sick pay provision is one of the first items we implement as a state on foot of the lessons learned during this crisis. Another recommendation in the report, Recommendation 7, recommends that adequate self-isolation facilities need to be a prerequisite in all care settings. Capital works in all publicly owned facilities need to be expedited to ensure that people can live in self-contained units and restrict themselves from communal settings if or when necessary. Meat plants emerged as significant hotspots for infections. While the meat industry has highly regulated itself in terms of food safety and hygiene, I do believe that just like the nursing homes, meat factories have highlighted that the same level of regulation and protection does not extend to these workers or their conditions of employment. Finally, Count Corla, I think it needs to be acknowledged that this crisis has been unprecedented. It has posed a relentless number of challenges to us as a state and to wider society. Emergency legislation, restrictions, lockdowns and other measures may not be palatable, but it needs to be acknowledged that all stakeholders have endeavoured to do their best throughout these times. I do believe that we need to constantly appraise and reappraise our performance throughout this pandemic in a non-partisan, collegial manner, and I thank the Chair for ensuring that spirit prevailed throughout the committee's deliberations. Sgur Magat.